Hello everyone, welcome to the module on the cardiovascular system. In this module, we will talk about auscultation of heart and effects of different maneuvers on different heart sounds. Okay, so let me just take you to this diagram. This is one of the most important diagram for clinical diagnosis. Now, we hear heart sounds majorly on four different areas, that is aortic area, pulmonary area, tricuspid area and mitral area. Okay, we hear it on four different areas, that is aortic area, which is on the right sternal border, pulmonary area, which is on the left sternal border, tricuspid area, which is on the left sternal border on the lower aspect, and the mitral area, which is on the apex of the heart. Is this clear? Now let us just talk about the different heart sounds that we hear on different areas. On the aortic area, we hear systolic murmur, and these murmurs are of aortic stenosis, flow murmur, that is the physiologic murmur, and aortic valve sclerosis. Is this clear? So we hear systolic murmurs, that is of aortic stenosis, flow murmur and aortic valve sclerosis. Now talking about the left sternal border, on the left sternal border we hear two types of murmur, that is diastolic murmur and systolic murmur. In diastolic murmur we have aortic regurgitation and pulmonic regurgitation. Is it clear? On the systolic murmur we have hypertrophic cardiomyopathy. So if in a patient there is a systolic murmur heard on the left sternal border, it majorly signifies hypertrophic cardiomyopathy. Is this clear? Now talking about the pulmonic area, the pulmonary area we hear only one type of murmur, that is the systolic ejection murmur, and the defects that produce systolic ejection murmur are pulmonary stenosis and atrial septal defect. These are the major pathologies which cause systolic ejection murmur on the pulmonic area. I hope I am clear. Now talking about the tricuspid area shows two types of murmur, that is holosystolic murmur and diastolic murmur. Now holosystolic murmur is produced by tricuspid regurgitation and ventricular septal defect. It is produced by tricuspid regurgitation and ventricular septal defect. Is this clear? And the diastolic murmur is produced by tricuspid stenosis. I am clear? Now talking about the last section of murmurs, that is on the mitral area, which is present on the apex, there are all the three kinds of murmur heard: holosystolic murmur, systolic murmur and diastolic murmur. I remember it by RVS, okay, because mitral regurgitation, mitral valve prolapse and mitral stenosis. Is this clear? So these are the different types of murmurs heard on the different parts of the chest, that is aortic area, pulmonary area, tricuspid area, mitral area. Is this clear? Now taking you to different effects of maneuvers on different kinds of murmur. Okay, so we have majorly 5 maneuvers which show different effects on different heart sounds. So talking about the first one, that is the standing Valsalva maneuver, there is a decrease in the preload. Okay, so this is the major cardiovascular change that occurs. So whenever a person does standing Valsalva maneuver, there is a decrease in the preload and there is a decrease in the left ventricular volume. Now due to decrease in the preload, the murmurs that increase with maneuver is mitral valve prolapse and hypertrophic cardiomyopathy. Am I clear? So the effects of the sound heard by mitral valve prolapse or hypertrophic cardiomyopathy increases with standing Valsalva maneuver. And most of the other maneuvers, most of the other heart murmurs are decreased in their intensity due to this maneuver. Am I clear? Now, talking about passive leg raise, in standing Valsalva maneuver, there is a decrease in the preload, whereas in passive leg raise, there is an increase in the preload. And so is with squatting. So in squatting, there is increase in the preload and afterload. Now in this, the intensity of MVP and HCM, that is mitral valve prolapse and hypertrophic cardiomyopathy, goes down, whereas the intensity of other murmurs, that is the stenotic or regurgitant murmurs, increases. Is this clear? Now talking about hand grip. In hand grip maneuver, there is increase in the afterload. Okay, there is a drastic increase in the afterload which increases the reverse flow across an aortic valve. Now when there is a excessive afterload, then all the regurgitant murmurs are usually heard very loud and clear. Okay, so aortic regurgitation, mitral regurgitation and ventricular septal defect, the intensity of these three murmurs are increased, whereas aortic stenosis and hypertrophic cardiomyopathy decreases. Am I clear? Now talking about the last maneuver, that is inspiration. Now in inspiration, there is a decrease in the intrathoracic pressure which leads to an increase in the venous return. Now when there is an increase in the venous return to the right heart, most of the right sided murmurs intensifies and most of the left sided murmurs decreases. Is this clear? Because the venous return to the left heart is decreased. So this is all about the effects of different maneuvers on intensity of different heart sounds. Thank you for watching this video. If you enjoyed the video, please click on the like button and do subscribe to this channel. Let me know in the comment section below which topics do you want me to explain. Thank you.